Welcome to the Eyecare Experts, Dr. Bell, Dr. Terrezza, and we've got back with us Dr. Ballard.
Hello.
We've had you certainly in the past, but some may have seen that podcast, others may have not, but thank you certainly for coming back. And before we get going today's topic, tell a little bit, as far as maybe your background,
Sure.
Where you went to optometry school, anything interesting you want to share.
Yeah, so I've been with Terrezza Optical Group for about a little over 5 years. Born and raised in Pensacola, Florida here. Went to Pensacola High School, then to University of Florida, and then did my optometry training in Birmingham at UAB, and have been back here ever since working with these guys.
And as far as patients that are watching that have seen you, or that are already established patients, or ones that want to see you, tell them a little bit where you're working at, your location, and days and stuff like that. Yeah.
So currently I'm 3 days a week at our Baptist location in the Henderson Health Building. So it's on the campus, but it is in a separate building on the first floor, where we have a full equipment, brand new exam rooms where we can do pretty much any type of eye exam or testing needed, as well as a full-service optical that provides glasses and contacts with a frame showroom as well. I do also work a couple days with Dr. Bell over at the Fairfield and Lillian office too.
Well, I know one thing. I've been going by the Baptist as far as when they first opened the hospital, and now it seems like every month, every 2 months, it gets busier and it's growing over there.
They're adding on, they're putting in new elevators, they're adding more parking. They're trying to provide pretty comprehensive sort of outpatient care. So, if you're already seeing another physician in the area, swing on by. We'll get you figured out if you need us.
They even have a helicopter pad.
They do have a helicopter pad.
For sure. I heard one coming in the other night. But the good thing I think about our locations too is each location, whether it's Baptist, whether it's Fairfield, whether it's Palafox, Milton, what have you, each location, we see primary care exams, and we have medical testing, OCT, visual fields, maculogic, B scans, ERGs. We have that at the offices. So, we pretty much can see and do everything at each individual office. Now, there are a few maybe dry eye equipment or something like that we may not have at each office, but for the vast majority, we can treat, assess, diagnose, and manage most patients at the local office or the closest office to them.
And we take most insurances too.
Yep.
And all the records communicate. So if you, had seen Dr. Terrezza downtown, or if you've seen me somewhere and you want to get your glasses downtown or whatever, all your information that they need to do that is seamlessly integrated. So there won't be any faxing or calling or anything needed for that.
Exactly. Yep. As far as October coming up here, it's ADHD Awareness Month and National Bullying Prevention Month. So those are two things, and that's going to factor in a little bit of what our topic is today. And our topic is the social impact of vision correction. We talk a little bit, usually most of them are talking about maybe eyes and vision. In this, we're going to kind of take that and expand as far as how it relates to kids, how it relates to learning, how it relates to their impact, how they're perceived, how other people perceive them. There's a lot of things that factor into this. If you had a parent that was just kind of asking you, or, what do you kind of, educate or tell or instill to kind of help?
Yeah. I guess from an optometrist, when we see a 7 or 8 year old, they have a little bit of blurry vision. It's correctable with glasses. That's sort of a routine thing for us. But when you think of the child or the parent or siblings and what that means for school and et cetera, that sometimes needing glasses is a bigger deal than it may appear from a health standpoint, And so I think it's interesting to kind of ground ourselves and know, okay, well, this is a relatively straightforward exam on our end, but when you're telling a 10-year-old that they may need vision correction, some of them are like, oh, yay, I wanted glasses, I'm glad I get glasses, and those are really fun. But other ones, they clam up, they get pouty, and they don't want to wear them. And sometimes that can affect compliance. If a kid is not feeling confident, or if they're not, they're intentionally losing their glasses or breaking their glasses, sometimes that can have long-term impacts on their vision. And I think it's a challenge sometimes to figure out the best way to approach that.
Well, the one thing we usually talk about, what do we talk about percentage-wise as far as not being able to see? How much vision relates to a kid's learning in school? You always kind of talk
Oh,
about
yeah.
that. How much impact?
So the numbers have changed in the last few years because of the nature of our societal changes with technology. But 65% of all learning occurs through the visual system. It's now at approximately 85. And it's almost skewed too much to the visual system, so we're not listening and using our auditory skills like we should. And there's the old saying, if you don't use it, you lose it. And I think that's true of communication skills, where if you concentrate too much on staring at a phone, then you're not able to communicate verbally. And certainly in the visual system, if you're using it intensely, number one, it needs to be monitored more because you will change as a function of what the environment is. And two, you're not, if you don't have proper vision, you won't function well on computers and reading and all the things that the society values, and it'll put you at a great disadvantage.
Well, today, for an example, and I think we've all kind of heard this, is, parents will come in with their kids, we'll do the exam, and we'll find maybe they have astigmatism, maybe they're farsighted, maybe they're nearsighted, maybe one eye sees better than the other. And then the parents will be like, well, I didn't know there was an issue, or I didn't know there was a problem. And sometimes it's hard. It's hard for a kid to kind of tell you, hey, there's an issue going on. Maybe they don't know because one eye sees good and one eye doesn't. Maybe they're squinting. Maybe they're doing things to kind of get by. But eventually, it's going to lead to fatigue. It's going to lead to issues. Sometimes eye turn issues. All these things kind of play a role. So, we always encourage to see all kids. We want to see you for a comprehensive exam. We usually say at least at age 4 or 5, bring them in for that full exam, even if they're seeing a pediatrician, because we're going to look health-wise, we're going to break it down, we're going to spend time focusing on the eye, whether it be health, whether it be vision problems. But even before age 4, if there's anything that you're noticing, anything squinting, maybe they have to walk up to a television, maybe one pupil's different size, maybe just something doesn't look right, anything that gives you pause, we want to make sure you come in, let us look at it. I'd love to sit here and say, hey, everything's great, nothing to worry about. But in a lot of these cases, there is something going on, and we don't want that to inhibit or limit a child's learning or make them avoid tasks or maybe them not do things that they would be able to do if they were able to see it properly. So it's always a good idea to bring them in. Let's figure out, let's see how bad the prescription is. And as far as ADHD, I've read a bunch of literature that even if it's a mild or small prescription where maybe they see well, especially if they're farsighted, sometimes giving them a pair of glasses may keep them on task and keep them focused a little bit longer. And anything we can do for those kids, any advantage we can give them, sometimes it pays off.
Right, and I wouldn't, and none of us would, say that we're a psychiatrist or a psychologist and we diagnose ADHD. That's not, the point. The point is, if sometimes parents are quick to, and this is not the vast majority, but sometimes they're quick to jump to a conclusion maybe they have already had an inkling about, or their, other siblings have, or something like that. And going down, the ADHD testing path, sometimes is more difficult than an eye exam, and it's a little more vague, a little more harder to diagnose. And so, sometimes it is worth the effort on the front end. Just make sure that they have all the tools to give them the best shot at successful learning. Now, most of the time, it's probably not the vision. There's other factors, obviously, but a vision fix, if it even is contributing, is a relatively low impact fix, or at least it can assist and maybe help, the behavior a little bit. And every little bit helps when you're dealing with children, of that age where the vision and mental development's critical.
Well, America loves a winner and despises a loser. So that's built into the society. It goes from roots we don't have time to go into here, but it's unfortunate. However, When a child's building his self-esteem, how he does on things like read and use a computer affects his opinion of himself. And once that's been damaged or hurt, when it could have been avoided by just being able to see better and get the information in quicker, which is a very relatively easy thing to solve in most cases, then it's a shame to have that effect long term that could have been avoided.
In that critical period.
Yes.
No, it's a great point. And the good thing about nowadays is 20-something years ago when I was in school, we have so many more options, whether it's frame options, whether it's lens options.
Rec space.
We have different sizes. We have different shapes. We have some with straps if it's a young kid to kind of keep them on, flexible, flex fit. I have some patients that don't like the ones that wrap around the ears. We have some that kind of just basically press on the head. There's so many different options nowadays that I think most people could find something that's comfortable, that looks good, that sort of thing, versus just like 3-pair, which you used to choose back in the day.
Right. And even, thinking on children that are maybe more athletic or, maybe they don't really care to read that much, but they're a great athlete. It's hard to hit 3-point shots or be a wide receiver if you're squinting and you're blurry, so don't assume that, I guess, they're going to be stuck with this big, thick pair of glasses. I mean, we have really great opticians and optometrists that can, kind of look at the patient and decide, maybe a contact lens is more appropriate. And you'd be surprised how young we can get kids into contact lenses sometimes.
In addition to that, you mentioned large prescriptions. Just this last week, the FDA, the Food and Drug Administration, approved the lens by Essilor for decreasing nearsightedness, and wearing this has been shown to help your prescription not develop as quick as it would, and so you wouldn't have as large a prescription as you change with age. Well, that's a big deal.
That is.
Particularly with females who are gauged on how they look, and we're very harsh on that scale also. But if you can wear a lens that would prevent it from getting a thicker and less cosmetically pleasing lens, that's even better.
Well, to that point, the jury, I think, is still out, but there's I guess, I would lean towards there's at least some data that supports that if you're, staring at your phone, especially at an early age, and you're doing that half the day, that's not good for the eyes, right? I mean, and it could cause nearsightedness. So, get off the phone. It's okay to be on there, but maybe parents limit how long they're on there. Get them outside. Sunlight is good. Sometimes being outside, throwing a ball, doing stuff out there is sometimes the best vision therapy you can offer. Yep. And there's studies, and we've talked about this before. The light itself, being outside in the sunlight, can actually reduce myopia and nearsightedness, looking far away. We've had contact lenses for a little while to kind of slow down, but this is a great thing that glasses have now come online, that we've got some other options to treat these patients with.
And for the FDA to approve that is impressive to me, because I've always been a little skeptical of, different methods for controlling nearsightedness progression. But, the contacts have been in existence for a while. They have been proven to, in most
The
cases,
crazy
improve
stuff
it.
on social media. I mean, you don't know what you're reading.
Right.
And these guys come up with these great plans and most of it is not based on facts.
Well, to me, there's two, with people seeing and vision, there's ones that just cannot see anything without glasses, right? There's some of us, like myself, I'm nearsighted, I can't see anything far away without prescription. So there are patients and there are kids who need that, but there's others that can say, hey, I can see without my glasses, but that still doesn't mean they may not benefit from wearing glasses. And that could be astigmatism, that could be farsighted, that could be depth perception. It could be, strabismus, eye turn issues, amblyopia, lazy eye. So those sometimes are the kids, I think, sometimes that fall through the cracks. Maybe they, had a school screening and everything went well, but they're still having issues, whether it's a learning issue or maybe letter issue. But any of those cases where you're like, hey, something's going on, or my kid's not, performing like I think he should, bring him in. Let us do a full eye exam. Let us check everything out and make sure that that's not hindering or impacting his learning, his social environment, any of that stuff.
And I have a kind of interesting recent example, if you want to hear it. I have a 10-year-old who, came in just random first eye exam, had a very small inward eye turn. Okay, so no one has really noticed. There's not much prescription, so glasses aren't really going to be the answer. We've tried to boost the strength of the weaker eye by, occluding or temporarily patching the stronger eye so he can use the weaker one more. It's not surgical because it's too small of a turn, and the vision's about 20/40 in that weaker eye no matter what we do with glasses. So, I'm thinking, okay, this kid's 11. We have a little more time to maybe improve it. He's not overly sold on the patching or anything, really. And so, I go, okay, if this is what we get, as long as you don't want to be a pilot, you'll probably be fine. And he goes, well, I want to be a pilot. So at that point, I'm like, all right, you got to listen up, because we're going to start doing stuff here. And so then after we had kind of done what we were at the capacity to do, I got him over to an occupational therapist who does vision training. And he called me yesterday and said we were making progress. He's getting better depth perception, vision's improving. I'll be seeing him next month to see how it's going. So it's little stuff like that sometimes makes a big difference on a career.
Well, we've said this a few times in the past too. With any, I guess it's fair to say, in most things, let's say it like that, if we catch it earlier, we have a greater success of reversing course. Right? So, if we see someone who's 3 or 4 and they have an eye turn issue, they're amblyopic, they have lazy eye, we have better success than someone who's coming in at age 7, 8, or 10. So that's the reason it's so important to get the kids in at an early age. And that's how the old infancy program got started. If there is something going on, we want to catch it as early as we can. That way the brain, the eyes don't get used to doing things the wrong way, and that way we can reverse course and get those eyes working together. But I wanted to thank Dr. Ballard for certainly coming with us in this. And what you said is, I think the whole premise of this thing is making sure, we get the kids taken care of and they don't have a stigma and the social doesn't come back and label them and become a negative.
And being a kid's hard enough. You don't need to add on anything that could be easily remedied, So give us the opportunity to make it a little easier. Go
to our website, TerrezzaOptical.com. If you want to schedule an exam, it's got all of our office locations there, the numbers. It'll kind of tell you a little bit about providers like Dr. Ballard. We've got a number of different providers. There's also on the top link, there's a resources tab where you can click on media, and it actually will have our podcast today and any of our past podcasts. So there's a lot of different topics we've talked about. Maybe you're keratoconus, maybe you have a family member that has this condition or that condition, and we're certainly trying to cover as many as we can. But certainly weigh in if there's something we haven't talked about and you guys are interested, or a topic that you have questions on. We'd love to hear from you. But thank you so much for viewing today, and stay tuned for future podcasts. Thank y'all.
Thank you.
See you.